Okay, great. All right. So, hello everyone. Before we start today, I want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day and on whose traditional territories our work takes place. While we meet today on a virtual platform, we can take a moment to acknowledge the importance of these lands, which we each call home. So my name is Autumn Seifitz. I am the project manager for the Canadian Coalition for Green Healthcare, and on behalf of the coalition, the Canadian Association of Nurses for the Environment, and the Ontario Nurses for the Environment, I would like to welcome you to our first Nursing Week event, Nurses Planetary Health Actions Across Domains of Practice. This year's Nursing Week theme is the power of nurses to transform health. And so we'll be really diving into that in terms of the lens of, environmental stewardship and planetary health and all the amazing work that nurses do to help make our world a better place and our health system a greener place. So throughout the event, please use our chat function for any technical issues you may be experiencing. There is a Q&A box for any questions you have regarding the presentation, and our panelists will be answering questions at the end of the event today. Um, I invite you to introduce yourself in the chat as well. We love to see who's joining us. We are recording this event, and the recording will be sent to all registrants probably at the end of this week or early next. I'm going to be sending the recording for all of our event recordings for all of our events this week all together in one package. But if you aren't aware of our other events going on this week and you're interested in attending more, um, I have the link there on the slide, but I will also put it in the chat so you can go check out what else we have going on. So now I'm going to hand things off to Maya to introduce herself and kick off today's presentations.
Hi, folks. So there is a bit of an echo for some people, but not for all people. Do you hear an echo when I'm speaking, or was it just with Autumn? Just going to give a second for people to respond. So for those of you who have heard an echo, just with Autumn. Okay, great. Sorry, Autumn, I guess you're a bit echoey this morning. Welcome, everyone. It is so great to have you here. My name is Maya Caligiru. I am an assistant professor with the University of Alberta, and I am also the past president of the Canadian Association of Nurses for the Environment. We have now, I think this might be our third year of doing Nurses Week with our dear friends at the Canadian Coalition, and we love doing it with them. We love that they love nurses because we do too. So thank you everyone who's out there for all that you do. We're super excited to bring you a whole week of webinars, and our kickoff one is this one. So to start off our week, we are going to talk about how nurses advance planetary health across different domains of practice. The way that it's going to work is that I'll just do a quick introduction to who we have right now with us, and then we'll go back-to-back presentations and we'll do questions at the end. So if you don't mind, if you do have questions, you can throw them in the chat right away and we'll get to them later, but otherwise you can also save them and just pop them in at the end. So I am super pleased to have with us today Dr. Emily Tremblay, who is the current president of the Canadian Association of Nurses for the Environment. So yay, Emily. We also have Ms. Farah Al-Gawish with us, who's representing the student body and their planetary health advocacy. We have Dr. Jennifer Bombush from the University of British Columbia, who's going to be speaking about long-term care. And we also have Dr. Heather Bade, who is from the University of Victoria, who's going to talk to us about the recipe book for ICU. It's like a planetary health recipe book, specifically that she developed with her team. So that's a quick intro to everybody. I'll let them speak for themselves. But Emily, please go ahead, take it away. We'd love to hear from you.
Thank you, Maya. And hello, bonjour, everyone, and happy Nurses Week. As Maya said, my name is Emilie Tremblay, and I'm the president of the Canadian Association of Nurses for the Environment. And I'm thrilled to present CANE's advocacy work in advancing planetary health today. But I'll begin this presentation by providing some background on CANE. So CANE's mission is to promote planetary health among nurses and people in Canada and globally. We achieve this by engaging in advocacy, education, research, practice, and policy at all levels of nursing. The association has existed since 2008, and we became incorporated, so a non-for-profit, in 2022, and obtained our charitable status in 2024. Our membership is diverse, comprising of nursing students, retired nurses, and practicing nurses from bedside, public health, and academic roles. We are well connected with other environmental advocacy groups in healthcare, and I'll highlight this with examples of joint initiatives today. But before I highlight Kane's advocacy work, I like to present Kane's structure and explain a little bit how we function as an association. So our chapters are divided into 8 provinces and regions, and we have 13 provincial regional representatives. So this means that some provinces and regions have more than one representative. So we're divided into, we have British Columbia, Alberta, Saskatchewan, Manitoba, Ontario, Quebec. And then our 2 regions are at the Atlantic region, which includes New Brunswick, Nova Scotia, PEI, and Newfoundland. And then we have our northern region, which is Yukon, Northwest Territories, and Nunavut. Provincial and regional chapters set their focus based on the member priorities from each chapter, while committees will focus on their specific objectives. And we have 8 committees at Kane. One of our committees is the Environmental Justice and Reconciliation Committee, and they're focused on environmental and climate justice, whether that's in research, education, and practice. Then we have our Education Committee, which is focused on educating on planetary health. We have our Social Media Advocacy Committee that creates social media content on the health impacts of climate change. And we have our Sustainability Committee that's focused on sustainability related to healthcare. Our public awareness team raises awareness on issues pertaining to planetary health. And then we actually have 3 other committees that do more like internal work, where the funding committee does fundraising initiatives that support Kane's advocacy work. We have our policy development committee that works on policies relating to Kane's activities. And then our membership committee focuses on member affairs. So the following 5 examples that I'll present to you today highlights Kane's advocacy work to influence public opinion and decision makers, as well as its educational work that builds nurses' knowledge, awareness, and skills for effective advocacy to promote planetary health. So the first 2 initiatives I'll present today are committee-led initiatives. The Kane Education Committee, in collaboration with the Canadian Federation of Nurses Union, led the initiative to develop the Nursing Toolkit for Planetary Health. It is a practical resource that guides nurses in responding to the environmental crisis through a planetary health lens. Essentially, the planetary health lens is that there's an inseparable link between human health and the health of the planet. This toolkit is presented as an interactive manual available in both English and French and includes sections that users can complete to support learning and action. And it begins with a foundational overview of climate change and its implications for health, followed by 3 action-oriented sections that offer guidance on addressing climate change at the individual, unit, and institutional levels. And it includes examples of projects implemented by nurses at each level. And together, these components position planetary health as an actionable and essential framework for nursing practice. Next, I want to highlight our environmental racism course led by the Kane Environmental Justice and Reconciliation Committee lead, and it was funded by the Hearts-Based Education and Anti-Colonial Learning Healthcare Project. This free short course was designed to empower nurses across Canada with essential knowledge about environmental racism and justice. It goes beyond theory by incorporating storytelling as well as a land and arts-based activities to foster empathy and encourage deep critical reflection. And through this approach, nurses gain insight into the systemic injustices that both perpetuate and are perpetuated by environmental racism, which is the disproportionate exposure of Indigenous, Black, and racialized communities to environmental hazards, pollutants, and climate change impacts. And this approach also helps nurses develop concrete strategies to advocate for equitable health across all communities. So those 2 examples are committee-led initiatives. Now, an example of work spearheaded by a Kane chapter is the BC chapter, which is leading an initiative driven by deep concern for the health for health and people and the planet, as well as due to heat waves that have become more frequent and intense. So in response, BC members will present at the May 14th Committee of the Whole meeting in Victoria, so in 3 days, and they're going to be calling on city councilors to pass a motion to maintain indoor temperatures in rental buildings at or below 26 degrees Celsius. Letters of support from individuals and organizations will accompany this presentation, highlighting evidence that this threshold can significantly reduce risks of heat exposure. And this initiative is informed by the devastating impacts of the 2021 heat dome that you probably all heard of, during which 619 people in British Columbia died. And as the BC Coroner Service reported that over 90% of these deaths were linked to indoor heat exposure. This work reflects Kane's ongoing commitment to protecting health and strengthening the resilience of communities in the face of climate change. And the next two initiatives I'll discuss come from Kane members who expressed interest in contributing to the work and wasn't necessarily led by a committee or a chapter. So in 2024, Kane collaborated with the Canadian Association of Physicians for the Environment on an advocacy campaign calling for a ban on fossil fuel advertising, recognizing that many significant health harms are associated with fossil fuel production and use. As part of this campaign, I spoke at a press conference on Parliament Hill in Ottawa on behalf of Kane in support of a private member's bill to restrict such advertising. And a key message emphasized during the press conference was that protecting the health of Canadians must be a federal priority, and that fossil fuel corporations should not be permitted to promote harmful products and misrepresent the risks they pose to Canadians, who will ultimately pay the price, many through deteriorating health, and for some, the loss of life. The last example of Kane's advocacy work that I'd like to highlight today is the Planetary Health Position Statement, which Kane co-authored with the Canadian Nurses Association. The position identifies the triple threat to human and environmental health, which are climate change, biodiversity loss, and pollution. The statement calls for coordinated action through education and research, advocacy and policy engagement, and practice and leadership within nursing. This collaboration is significant because the Canadian Nurses Association plays a central role in advocating for a strong public health system, shaping federal health policy, and supporting nurses through national ethical standards and a unified professional voice. Kane's participation in both the fossil fuel ad ban campaign and the Planetary Health Position Statement is particularly impactful, enabling the organization to influence federal policymaking and ethical guidance for Canadian nursing and to elevate planetary health as a core professional and public health priority. So Autumn mentioned at the beginning of the presentation, demonstrating the power that nurses have to make a change. I hope that you could see that Kane is doing some fantastic work. And if you're not already a member, we would love to have you if you're interested in joining. And if you're already a Kane member, thank you for all the work that you do. And thank you so much for having me today.
Thank you so much, Emily. Emily, at some point, we'll have to leave our lovely session due to scheduling, and I will handle the Kane questions should any come our way. But thank you so much. It's always so great to hear about the work that we do. And yeah, there's always a space for anyone who's interested. If you're a nurse, if you want to do more in the planetary health field, come on by and join us. There's plenty of room for everyone. So with that said, we're going to move over to Ms. Farah, who is going to talk to us about students in planetary health. And so, Farah, why don't you give us a little introduction and take it away? And you're just on mute, by the way.
Yeah, thank you so much. Okay. Hi, everyone. So my name is Farah, as mentioned, and I'm joining you all today from Treaty 6 territory, which is the unceded home to many Indigenous people, including Cree, Saulteaux, Blackfoot, and Métis. I'm so excited to be here with you all today and talk a little bit about my student perspective. So, a little bit about me. I'll be going into my final year of the honors nursing program at the University of Alberta this upcoming fall. And I'm going to be talking a little bit about my journey in planetary health as a student and also highlight some key takeaways for students who are in this call or just those who are interested in getting involved in the field. So, A little bit of background, I guess. My passion for planetary health and climate change began because I grew up in one of the most populated cities in the world, which is Cairo, Egypt, where more than 12 million people live. And so from a young age, I got to see the downstream effects of pollution and climate change firsthand. And this awareness stayed with me even before I knew what the word sustainability meant. And eventually, when I joined the University of Alberta, you can go to the next slide. I joined the Sustainable Development Goals Student Alliance, and I've been with the Alliance now for 3 years. Now I'm past president, and my work there have encompassed leading campaigns that are primarily focused on reducing individual environmental footprints. So we do a lot of campaigns on like that are very fun, targeting youth particularly, such as like learning how to make like lip balm or body scrub from reusable and locally sourced ingredients. And the idea is to encourage youth to create rather than only consume, and also think about how much pollution is caused by our daily usage of resources. And that could encompass transportation, like transportation waste or wrapping, or even just the waste of what we use. And hopefully try to encourage them to alter their consumption habits just a little bit. Because I'm a strong believer that the compounding impact of very small and daily individual actions and choices can create huge, meaningful change. So through this work at the SDGSA, when the Edmonton School Public Board launched their compost bins on school in public schools, we played a huge role in speaking to students across the city about composting, and we created educational materials and pamphlets for public schools, one of which is on the screen right now. We created multiple ones based on like different education levels and lots of presentations, and a lot of our work is very grassroots and community based. We're also writing um, a policy brief to the university about implementing compost bins at the residences of the University of Alberta campuses. So lots of it is very community based, which I really love, and focused particularly on SDG or like Sustainable Development Goal number 12, which is responsible consumption and production. And through this alliance, I've also began exploring the intersection between what I study, which is nursing, and particularly my passion for mental health nursing, and also my passion for sustainability and the environment that we live in, which initially I thought were two worlds that didn't really connect. But finding that meaningful area where they do was quite intuitive and quite rewarding to me, which is planetary health. You can go to the next slide. So, the last year, I served as the environmental sustainability advocate of the Canadian Nursing Student Association, or the CNSA, which was a cool group to join. I collaborated with nursing students and faculty members and organizations across the country on projects that relate to sustainability and health. And I think my biggest takeaway from that role was that the connections that I built with others, or that we built amongst ourselves in the community with people who are interested in this work, is truly one of the most integral pieces to creating projects that have long-lasting outcomes. One of the projects that I'm most proud of, or like that I worked a lot on during my term, was co-writing the 2026 Planetary Health Position Statement along a fellow nursing student and a close friend of mine. Her name is Asha Jama, who also studies at the University of Alberta. And our position statement explored 5 different sustainable development goals, which are on the screen right here. So that's zero hunger, good health and well-being, clean water and sanitation, climate action, and partnerships for goals. So these are 5 of the 17 sustainable development goals, and we explored how these 5 goals basically directly connect to our nursing education practice, and we included recommendations for how these ideas could be implemented in healthcare and also into our nursing education. This position statement resulted from a rapid review that examined these goals. And I'm actually very excited. I'll be presenting it at the CNA conference this upcoming September. So if you're there, please stop by and say hi, and also hear about the work that we've done. This poster was more for like knowledge translation purposes, and it was shared with nursing students across the country. And it's also on the CNSA website. It's basically a summary of the very long position statement that we wrote, and gives an overview of what planetary health is and how these goals that could look a little bit different at first sight actually connect very heavily to our health and to the health of the population and to our nursing like careers. So um, we can go to the next slide now. And part of why I felt very encouraged to engage in this field is because I've seen planetary health integrated into my nursing education directly at the U of A, and I felt like that was really awesome. It was very happy when planetary health was mentioned in my classes. Um, and it was discussed as a major social determinants of health, especially in mental health, which I find very impactful because instead of teaching it as a very like separate concept, it's shown as like directly connected to our patient care. And this is one mental health framework that really stood out to me. It's the socio-ecological model, and it touches on a lot of planetary health concepts in determining uh, the illnesses that an individual can present with. And the reason that I mentioned this framework is because it shows that in my education, planetary health is an emerging interdisciplinary topic, and it's increasingly being embedded into our education system, not just for nursing, but also for other healthcare workers. And as student nurses, we're entering healthcare at a time when climate change is already shaping the health of our patients and our communities. And so I'm very eager to see more of that integration of planetary health into our education system. And I know I'm not the only one who get super excited when this gets mentioned in class because during my term at the CNSA, I met students across the country who recognize that planetary health is nursing work and who are either like working in research in this area and who are working on also report cards, planetary health report cards, which I'll touch on briefly. So we can go to the next slide. Yeah, these are planetary health points. We can go to the next slide. So I also wanted to just end by saying there are a couple of ways that students and also people who are not currently involved in planetary health to get involved. Go to the next slide. So um, one of these opportunities is to find the Planetary Health Hub or the Planetary Health like group at your university. I think this is a great start. So at the University of Alberta, we have the Climate Change and Health Hub, but there's different ones across universities across the country. And it's a really good start to getting involved. They present opportunities for volunteering, for research, and also even classes that students can take that can be beneficial in building their planetary health awareness. I also know in our university we have the Planetary Health Certificate for undergraduate students. Um, and these are pretty cool because sometimes they hire students. I'm also starting my leadership placement in the Climate Change and Health Hub, so I'll be working with them very directly and pretty excited for that. So there's lots of room for students to get involved in these hubs. And then the second point, on the next slide, and that's the Planetary Health Report Card. So this is really cool project that aims to evaluate and improve planetary health content in professional schools. And students can basically publish the report about their school's curriculum, research, and their advocacy. And this aims to compare schools across the world about like what is currently being done in planetary health. And it's pretty cool. If you're interested, check it out. It's a really cool publication to have as well. And that is it. Yes. Thank you so much for the link. The link is also in the chat. And thank you for listening.
Great. Thank you so much, Farah. It is so lovely to hear students speak about planetary health. It's so invigorating, and you guys are absolutely the future of our profession. You are the future in general, and I loved having your energy brought to this webinar, so thank you. So we're going to move along to Dr. Jennifer Bombush over at UBC to tell us about long-term care. So Jennifer, take it away.
Thanks so much. Yeah, that was a fabulous presentation by Farah. So I am going to be giving a brief presentation about some of the research that I've been doing, mainly in long-term care, around nurses working in the context of extreme weather and climate change. I'm a professor at the University of British Columbia, which is located on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. So just in case you'd like to know more about my research program in climate resilience and health equity, this is the website that you can check it out. I started doing work in this area during and after the heat dome that Emily mentioned that happened in Vancouver in 2021. And my research mainly focuses around building capacity in communities that are vulnerable to climate change, specifically older adults, people with lifelong disabilities, and their family caregivers. And my background is in long-term care nursing. And so a lot of my research in this area has focused on that. And so after we had a series of extreme weather events in British Columbia in 2021, I became really interested in learning more about how nurses experience those while they are caring for residents in long-term care homes. So my team and I conducted this study, which is a qualitative study, and we tried to recruit nurses from across Canada. As you can see, most of the participants came from British Columbia, where I'm located, and where we have a pretty constant awareness of extreme weather events, especially through the spring, summer, and fall. And so we had participants, and we really just wanted to ask people about what are your experiences of working during an extreme weather event? How did that impact the residents, the families, and how did that impact you as a nurse? And so you can see that our participants were between the ages of 28 and 60 and had an average age of 44, very typical of the general nursing population. All but one of the participants were women. And you can see that our participant group had a lot of experience, and many of them had worked for more than 10 years in this sector. We asked nurses to talk about their experiences during extreme weather event. And so these are some examples of the extreme weather events that nurses shared with us. And it's a good reminder that across Canada, there are many geographies and that people experience different extreme weather events depending on where they're living. And that we really need to be looking at local as well as pan-Canadian supports for nurses who are working during these events. These are some of the stories that we heard from nurses in this study, and I've just sort of brought together a collection of them. We heard from nurses who shared stories and experiences about evacuating large long-term care homes on a Saturday night. If you've worked in long-term care, you'll know that on a Saturday night, it's basically you, if you're the regulated nurse, and a group of care aides. And so it's an incredibly difficult time to be doing an evacuation, and reminding everyone that while nurses are evacuating, particularly for wildfires, for example, that wildfire is also approaching the nurse's own home. And so there are a lot of stressors involved in those situations. Another nurse shared story about arriving on shift during a heat event, and all of the residents had elevated temperatures. This was during some of the COVID-19 public health measures, and so at start of every shift, people were typically doing temperature checks, and none of the residents were actually sick from a virus. They had elevated temperatures because of the heat inside of that care home. Most care homes in British Columbia do not have any air conditioning or other mechanical cooling systems. Nurses shared experiences about power outages, the challenges of those, and just knowing, how long is the power need to be out before we start evacuating, especially if the generators aren't working. Nurses talked about their experiences during snowstorms and ice storms, and also extreme flooding, which has been happening more frequently here in British Columbia and being referred to and called atmospheric rivers, where it rains really, really hard for days on end. We get a lot of rain here anyways on the West Coast, but this is very heavy and persistent. And we actually had experiences during 2021 where entire highways were wiped away, cutting off some care homes from their usual suppliers. So this nurse told us about her experiences of working during the heat dome in a care home that had no air conditioning. And she said, I had to think outside of the box and create a makeshift air conditioning unit with ice blocks and the styrofoam box and a fan and a J tube that you would get at Home Depot or Lowe's or something. And I YouTubed it and I tried to figure out how to get cool air on these poor residents. So nurses are literally what we would call MacGyvering it during their shifts and outside of their shifts to try and support residents during these extreme weather events. This is an example of a nurse who was doing an evacuation of residents, people living with dementia. And she told this story about trying to get her residents out of the building during the evacuation. And she shared one gentleman, because of his work experience, was accustomed to being in charge. And so he was very physically aggressive at times and was much bigger than us. So I just went up to him and I said, hey, I said his name. I said, do you know we're practicing our evacuation procedures? Would you like to help? And he said, yeah, cool. And he actually followed me out and got onto the bus. And so even during these times of extreme crisis, nurses are still doing their best to provide person-centered care. And I think this is also a really important point that nurses don't let go of their professionalism, their expertise. This situation took a lot of advanced gerontological nursing expertise in order to move residents with advanced dementia out of their care home and into the evacuation transportation. And it's a really beautiful example of a nurse who used their expertise and took the time to do that in a way that was not forcing the resident and was bringing him along on that experience. So those were the nurses in the study where we were looking at their very personal experiences of working during extreme weather events. I've also worked with the team recently to complete a study around climate readiness across our long-term care home sector. And so this is more at a facility and systems level to look at what is happening across the sector. And we conducted this survey in British Columbia. I'm just going to share a couple of the slides about the work around environmental sustainability and stewardship that's being done in this sector. We had 84 participating sites, and it wasn't necessarily nurses who completed the survey. It was a site leader. So in some cases it was a nurses, and in some cases it wasn't. But when I show you some of the work that they're doing, nurses are definitely involved in supporting these initiatives and promoting planetary health and sustainability within their workplaces. So in terms of site sustainability programs and services, you can see there's a lot happening. Certainly we can look and focus on increasing some of those initiatives that are just at sort of the halfway mark. I think providing examples for different sites about how they can start and sustain some of these practices is really key work because there are great initiatives happening across the sector. So for those of you who are a similar vintage as me and you're awake sometimes at 3 a.m., these are the kinds of things I'm thinking about: nurses and climate change. Nurses are the largest healthcare workforce in Canada and internationally, and it's been that way for a really long time. Nurses are great problem solvers, critical thinkers, and innovators in crisis situations. So we saw that from the nurse who was creating air conditioning units on the ground, going to the local hardware stores to try and get her supplies. That's what nurses do. And I think nurses in long-term care homes are particularly talented at this because they're often working in a very isolated way with a lot of responsibility for a lot of people. I haven't talked about this today, but organizations rely on nurses during extreme weather events. Oftentimes, there's nobody coming in to save you. Oftentimes, administration is a phone call away, but they're not actually on site. And so, similar to many aspects of nursing that we see, and we certainly saw during the pandemic, that while nurses are on the ground during extreme weather events, oftentimes are being under-resourced by their organizations, and this can lead to burnout and long-term mental and physical health impacts. And I think this is going to be a crisis for the nursing workforce in the coming years, unless organizations start to provide more tangible supports around mental and physical health supports and workplace safety. And my last point that I think about is that nurses are currently underutilized in the planetary health and climate change sector within healthcare and beyond. And I think that there is such great potential when you bring nurses in, because we're big thinkers, we're critical thinkers, we're problem solvers. And it's really important to get that nursing perspective, which is so unique in understanding the patient, resident, client experience, that lived experience of working with people who are receiving care, while also thinking about the organizational issues and aspects to promote climate resilience. So with that I will conclude and pass it back to Maya.
Jennifer, thank you so much for that. I was really moved when I heard about that nurse, like making, YouTubing that video and making, the AC unit for her residents and the innovation to get the person out to the bus. Like my father-in-law has advanced dementia, and I can't imagine the nightmare it would be to get him anywhere fast. So this is such important work, honestly. I feel like we know long-term care is totally overlooked in terms of support and funding and in general, when research is conducted. So I'm so glad that you are doing this. And I hope more people are explore this field because it really needs to be brought to light. The work that these nurses are doing is amazing. So thank you, Jennifer. On to Heather. Heather, please, we would love to hear about ICU and the exciting things happening there.
Hi, can I just do a sound check and a slide check? Can you see my slides and hear me?
Oh, I see you and I hear you, Heather. You're good.
And can you see my slides okay?
I can, yes.
Okay, great. Thank you, everybody, and how fantastic to be here during Nursing Week and celebrating nursing and nursing students and nursing clinicians doing such fantastic work. As Maya said, my name is Heather Baid, and I'm returning to Canada, originally from Canada, but I've been living away for about 25 years and only joined the University of Victoria in January time, a few months ago. So new to the area, and my contact details are there. And I'm going to provide some international perspectives, mainly on the intensive care environmental sustainability recipe book, but also on some other international things happening in the UK. And I was going to mention the Planetary Health report card too, so I'm glad Farah did as well. Just to acknowledge the lands where I'm coming from. You can see my background, the beautiful forests that make up the campus here at the University of Victoria. I'm very grateful to be a visitor on these unceded territories of the Lekwungen and Wisamish peoples. And while we're talking about planetary health, just recognizing the connections between Indigenous knowledge, Indigenous ways of being, and promoting the health of the planet. So having lived in England for some time, I was well used to the national department of what's called the Greener NHS in England, and there's the same in all countries. So I thought I would share this. In fact, England, strange. I always found it strange that England was the first country to do this, but it comes with politics, with the funding streams coming and going, and I think people are quite concerned about whether this is going to, how do you sustain the sustainability type of viewpoints, but there is a national strategy. It did come out during the pandemic. So whenever I used to teach this, mostly nurses don't know about this, but we have in England had a national strategy since about 2021, and it's been updated quite recently as well. And they've also embedded into the Health and Care Act in 2022. And so what that means is there's a legal statutory requirement for all healthcare organizations, whether that's hospitals, long-term care, paramedics, GP practices, wherever you work in healthcare, there's a requirement to reduce the environmental footprint, mainly focusing on carbon, but recognizing that as speakers have already highlighted today, that climate change and carbon footprint is important, but also biodiversity loss and air pollution. And England's one of the few countries to have done national carbon footprinting of the healthcare service. And what you can see here is that the majority of the footprint comes from clinical work. And so what an opportunity when Jennifer was saying that, nurses make up the biggest proportion of the healthcare staff population, what a contribution we can make as nurses to be addressing those sort of blue and teal, medicines, medical supply chain, equipment supply chain, that's the daily stuff that we're using on a day-to-day basis. So the decisions that we make as nurses have an impact for our patients, but they also have an impact on the planet. And so in England, in order to address that big carbon footprint, many specialities have moved towards having not just position statements, but specialty-specific guidance document to bring this national policy that's very much top-down to an operational level so that clinicians have something easy, everybody's busy, nobody's getting a coffee break on long 12-hour shifts. So how is a nurse or a doctor or a dietitian supposed to think about worrying about the planet when, everybody's struggling just to get through the day? So the idea of the recipe book was it was specific for intensive care clinicians who are really busy, but no pun intended, to make it digestible. So not another checklist, not another care bundle or a pathway. We've all got too many of those. It's essentially a checklist though, but we just branded it and the aesthetics of it is presented as a recipe book. At the time, I was working at the University of Brighton, so I led on this national project. But it originally came from the Intensive Care Society, who then collaborated with the UK Critical Care Nursing Alliance and the Faculty of Intensive Care Medicine. So there were national ICU groups, and we developed this recipe book over a year just to acknowledge the funder. We were very fortunate to get a big grant from SBRI Healthcare and Greener NHS, which paid for a research fellow, so just to acknowledge Pat Coelho's work as the research fellow. And so for this project, we had a really fantastic interdisciplinary team. And as much as we're celebrating nursing today, we don't work in silos. We work with all of our healthcare colleagues, as well as service users, the patients and families. So we felt that was really important to include a service representative on the project team and advisory group. And then we also conducted staff focus groups just to hear what are the challenges that people are having, what are the barriers, and what are the success stories, like who's cracked certain topics, and then let's share those case studies with others. We did some interviews with former patients and family members, and also conducted an extensive service evaluation where the research fellow in some pilot sites looked at procurement, reviewed policies and guidelines, observed clinical practice, did some waste and linen evaluations, and in collaboration with the Centre for Sustainable Healthcare, did carbon footprinting on some hotspot procedures. I've only got 10 minutes today, so I'm not going to include the carbon footprinting data, but if anybody wants more information, happy to share more details at another time. And we all know we use a lot of plastics. We don't need a research study to tell us that. But what do we do about it? What do we do about all those plastics? We open up packs and throw out half of it, but we don't have any control, or we feel like we don't have any control as clinicians because the packs come from the shelf, but how does it get to the shelf? And so really looking at how can we work with industry and in redesigning and really looking at, what are we actually using on a day-to-day basis? Because we know all those plastics add up and create a huge amount of waste. Intensive care is one of the very intensive, no pun intended again, areas for creating waste. And the waste evaluation showed that, these pictures, the one on the bottom middle was 24 hours from one patient, which added up to 32 kilograms. It averaged out about 10 kilograms per intensive care patient, or patients who were receiving high dependency, so maybe not quite as sick, about 5 kilograms. So that's a lot of waste. If you add that up per patient, per unit, per hospital, per country, per international. So what can we do about it? And the other thing we found in the waste evaluation is that we're pretty bad in the intensive care area about putting the right things in the right bins. So we're spending a lot of money burning packaging and gloves and things that don't need to be there. And I'll put my hand up and confess that I've done it too as an intensive care nurse. The easiest thing that's closest to you is the sharps bins that's right there at the bedside. So lots of room for opportunity around only putting sharps in the sharps bin. So we base the recipes on this model, which comes from the Centre for Sustainable Healthcare in the UK, and they've had this for some time, and it's very similar to other environmentally sustainable healthcare models that you may be using in your areas, really focusing on prevention. A sustainable thing we can do is patients not get sick in the first place, not need the intensive care in the first place. So lots of opportunities for health promotion, preventing disease, preventing complications. Patient self-care is difficult in an intensive care environment, but there's very much a move to, less sedation, getting people up out of bed more. Lots of patients can brush their own teeth, but the culture is we kind of get in there and do things. And so, lots around patient empowerment and lean service delivery, reducing waste. We don't have that many low carbon alternatives in intensive care, but where possible, for example, around reusables, using low carbon alternatives. And I'll put the links in the chat afterwards, or it's freely available. You can download it for free, and we encourage you to use it. It's very much written from the UK context. The resources are specific to England, Wales, Northern Ireland, and Scotland, because it was a national UK initiative. But the recipes are built around those 4 themes, but then bookending it with some team-based recipes and education, quality improvement, and research at the end. So this is an example of the first recipe. And you can see there's the ingredients, just like if you were cooking, you have your ingredients, like what do you need to do that particular topic? And then what are the methods to go about, and a case study. Lots of pictures, lots of bullet points and hyperlinks, as we said, just to make it really digestible, really easy to use at the bid space. Also recognizing that some recipes are going to be easier than others. In some places, some hospitals, that might be quite easy because that's the culture to, already do sustainable waste management, where other bullet points might not be so hard. So there's an audit tool for keeping track of the recipes on the website. And the intention is that we don't all have to be perfect. Even if we just do a few things, everybody doing a little bit is going to be more impactful than a few places trying to do everything. But just going through the recipes, looking at what's feasible, making some smart goals around, what can we achieve over the next 6 months. The urgency of the healthcare is that we don't have time to waste, but to be just trying to be as environmentally sustainable as possible. I had the pleasure of listening to Jennifer speak Saturday at a gerontology conference here at UVic. And, it was really interesting hearing the perspectives that she was presenting around service users and families and residents in long-term care. And that's what really came out of our discussions in collaboration with the patient representative. He told us in one of our early meetings when we were talking about gloves and trying to reduce gloves waste, he said, don't you always have to wear gloves in a hospital? He said, you've never seen a nurse not wear gloves, and he was really concerned about that. And it really struck us that we were doing all of these environmental sustainability initiatives, but not necessarily including, let alone talking to families and patients about that. So he helped us to co-design this flyer to be really transparent with families. But, we know people and patients are really concerned about the environmental planetary health crisis that we're all in, and just being transparent about, we're an intensive care unit that really cares about this, but we're putting patients first as a quality improvement initiative and making sure that that's a focus, but we're also trying to save carbon and other environmental damages at the same time. The other poster here comes from the Royal College of Nursing, and they did a big initiative, I think about a year or two, maybe 2 years ago now, with flyers around, just creating that public awareness because of the sort of myths around gloves use in particular. And I'm knowing to time, so I'm just going to fly through a couple of slides just to give you a sense of just all the work that's been going on in England for the last several years. There's something called the SUSQI framework, lots of free resources, and I'll put all these links in the chat afterwards. Really fantastic green board competition. So I'd really encourage you to get that healthy competition going, a bit like the Planetary Health Report Card, where the students are kind of competing with each other at universities, who comes out with the A on the Planetary Health Report Card. These kind of initiatives where who can save the most carbon, and oftentimes the financial sustainability element comes into it, and more often than not, in my experience, you're saving money while you're also saving carbon. There's green ED initiatives nationally, there's surgery, and there's various other ones. I've just picked out a few here today. I just wanted to quickly comment on the social sustainability element within that triple bottom line of sustainability, that if we're greening up, but we're still using child labor and modern slavery in the supply chain. And if you weren't aware, this picture shows how most of the world's healthcare supplies are made. Every time you go to work as a nurse, you're contributing to modern slavery and child labor. It's just how the system's built at the moment. And the pandemic really brought to light, like, where does all of our stuff come from? Because suddenly we can't get it anymore. And it really started to open up some questions around we have fair trade in food and clothing. We don't have it in healthcare. And in England, they're starting to make this a requirement of industry, and some The British Medical Association has got some fantastic resources and videos on that, if anybody's interested. So just a final comment, there's some free climate resources for health education. It's an international nursing initiative. There's a nursing element as part of that. I've been part of that. Happy to give more information another time if people would like to know more. And also I was going to talk about the Planetary Report Card, but Farah did a beautiful job of that. I helped to set up as a faculty advisor the first nursing adoption several years ago. It started with medical schools, and as a university academic, it is so fantastic. I mean, Farah, your enthusiasm and your leadership in this area, we have so much to learn from students and to work in collaboration. And the Planetary Health Report Card, fantastic initiatives. There's tons of medical schools that do it now, as well as other disciplines. There's not as many nursing. And so I'd really encourage any nursing students or anybody working with universities. It is student-led. It has to be done by students, but they need help in finding the evidence, as I put in the answer to one of the questions. And final comment is, I really think that, ultimately we're caring for patients as our top priority. And so branding sustainability as quality improvement can be really successful. You've all come today. You're probably interested in planetary health if you've come today. But when people are busy or they're not always engaged, they don't necessarily have the language, it's not something they were taught before as nurses. But everybody wants to improve care for your patients. So for me, sustainable healthcare is quality care. So how do we improve and maintain that quality, but a way that's socially responsible, financially affordable, as well as being environmentally sustainable? And that magic, combination of all of those can exist. We just have to, and we have the will for it. We just have to do the work in making it happen. So thank you very much for the time today. And if anybody, I'm new to the area, so really looking forward to collaborating with people here in Canada now on initiatives.
Great. Thank you so much, Heather, for that. That was very interesting. I feel like, first of all, I have very little knowledge about what you were saying, a bit dark, but this child slave labor and all that in healthcare. Like you said, we think about this with clothes and, and electronics and things like that, but I didn't even think about the correlation there with healthcare. And so I feel like that's a webinar all on its own. And perhaps a little more lightheartedly, I was chuckling to myself about the competition nature of getting nurses involved. I'm like, nurses are nothing if not competitive.
I
So
know, right? I
getting,
know. I mean, listen to me saying, how many medical schools are there? And I was looking I thought there would be more nursing schools, and there was more nursing schools this year, but there's so many more nursing students than there are in the world. And
yeah,
so,
absolutely. So definitely harness that energy. So there is a question actually for you, Heather, in the question and answer box here. And it says, how hard or time consuming was it to do LCA? Is it scalable? I'm not quite sure what LCA means. Do you?
life cycle
Oh,
assessment
okay,
for the
great.
carbon
Yes,
footprinting.
yes.
Very hard, and it's a can of worms. And I sense whoever asked that, I can't see who asked it, probably knows. And there is debate as well. It's so time consuming doing full, extensive life cycle assessments. All of that time spent assessing is not doing. So there is an argument to whether you carbon footprint or something or not, well, you just crack on and do, so let's take gloves as an example. If you do a gloves aware, not everybody likes the phrase gloves off, but gloves off, gloves aware, whatever your gloves initiative is. And the first gloves projects starting in Great Ormond Street. And actually it was set up by nurses. I don't know if anybody knows that. So it's a fantastic example of nurse-led initiative. And it started with the infection prevention nurses and the nurse educators. And it didn't start off as an environmental sustainability piece, but as, people aren't washing their hands properly and they're wearing too many gloves. So they didn't carbon footprint and they didn't do a life cycle assessment, but they saved a ton of gloves. I forget how many, like tens of thousands, and they translated that into money. There's an assumed carbon footprinting reduction. So one thing I would say is, do we need to do the life cycle assessment or do we just assume that it's lower? Because all that time and energy and money, and it is quite hard. Because we had a grant, we worked with the Sustainable Healthcare, and there were sustainability analysts that this is their job. And so we did have that help. It changes all the time. It depends on, there's so many difficulties in getting an absolutely accurate one as well. Just and there's different types of carbon footprinting, but you can do quite a quick and easy, what's called a top-down approach using financial data. And the Center for Sustainable Healthcare has information on how you can do that as a nurse. And I'd be happy to talk to anybody afterwards further if they wanted to branch out into the world of carbon footprinting. There's also a free repository now called Healthcare LCA. I'll put it in the link. And so where carbon footprinting studies have been published, there's this open source repository now. So if somebody else has done it, you can go and have a look. It'll change. It depends on transport in different countries and things. But if it's a baseline, it gives you a ballpark figure. You make some changes and then your baseline goes down. It doesn't matter whether the actual number is accurate or not. I would argue no. So, did that answer the question?
Uh, Answered it for me, but I didn't ask the question, so I'll let the person who asked that maybe just throw it in the Q&A section for us so that we know. In the meantime, we only have a few more minutes left, so and I will ask a question for Farah. Farah, you've heard a little bit here today, and of course, what nurses are doing out there to advance planetary health in a variety of settings. And I'm just curious from the student perspective, do you feel, or, in terms of the preparation you are hearing more about planetary health, in your studies, but I guess I know that we're not doing enough, so I'm not going to ask you, are we doing enough? But what I would like to know is, what would you like to have learned more of? I mean, again, you're hearing people in Jennifer's study that they're building AC units. You're hearing Heather here, nurses are filling out checkboxes and they're, doing like life cycle assessments, they're participating in these things. What kind of preparation do you hope to see as a student for nurses coming in the future and kind of after you?
Ooh, that's a really good question. There's a lot that I can say, but for the sake of time, I feel like learning how to be more sustainable in our material usage is a huge one, and I love that Heather has mentioned that. And also learning that planetary health is quite integral to the social determinants of health of our patients, not just in mental health settings, but also in acute care settings. Because I think we get too deep into like the pathophysiology and how to treat the presentation and the symptom rather than understanding like the intersectional system of like factors that brought the person here. Um, I think that understanding could be quite beneficial in order to target more upstream causes of not mental, sorry, just like general illnesses, rather than focusing on downstream. And I feel like that could be a bigger healthcare movement towards like more public health promotion and just having that awareness from my earlier on in training I think could be quite beneficial in like shaping the future of healthcare and shaping it in a more like upstream public health focused. So yeah. But lots to add there, but I'm just gonna keep it at that because I understand we're short on time.
Great. And so we have 2 minutes, and I don't, there is a question, Heather, for you in the Q&A section. I'll let you maybe just type an answer for that. I'm going to just ask a quick question for Jennifer here with the last time that we have. And, I'm just sort of curious, what is next for your research? Again, I think it's really interesting what you're doing right now. There's so much work still to go. And I'm just curious what is still coming down the pipe for you, and what are you working on?
Thanks for the question. I think, and I just want to say too, I think in Canada, we're leaders in this area of research, and Maya, your work is part of that too, and Emily and everybody. And it's really exciting to see. My focus right now is on developing climate readiness plans for long-term care sectors. So I'm just launching a CIHR funded study around that. And I'm hoping to do more work around workplace safety for nurses in the context of climate change. Because like I said, I think that very similar to COVID-19, this is sort of the next big impact on the nursing workforce. And I'm not sure that employers necessarily really see that aspect of it and the long-term consequences for nurses in terms of physical and mental health issues that can come about from working during extreme weather events and from climate change in general. So those are areas I'm really interested in. But I will say there's a huge array of areas for inquiry in planetary health and climate change. And I think nurses have such a central role because, of the kind of clinical work that we do with people and the leadership positions that we are able to hold. So I just encourage everyone to get involved in research and inquiry and clinical guidelines and all those great things where we can really be advocating across all spheres of nursing for improvements in terms of how our climate resilience across our healthcare system is built.
Thank you. And with that, we will wrap up. Again, I want to wish everyone a happy Nurses Week here. I think what we've learned here today is that nurses are innovative. They are willing to work hard for their clients. We've known this. We're not learning this. We reiterate that, nurses are excited about planetary health. We have a real role here, as Jennifer said, to take a leadership position in advancing planetary health. And we're going to keep talking about that all week long. So please join us for more about nurses and planetary health throughout the week. Again, thank you on behalf of Kane and the Canadian Coalition for Green Healthcare. And thank you so much for our panelists here today. You guys were excellent. Really round of applause here. So thanks, everybody. Really appreciate your time.
Thanks, Maya. Thanks,
Thank
everyone.
you.
Take
Happy
care.
Nurses Week, everybody.